Hello, everyone. I am Dr. Marty Ross, and this is another Conversations with Marty Ross MD. This is the last of our October-November series. I'm going to take next week off, and then the week after that, we'll resume again. It's good to see you all here. I see some familiar faces and see some new people as well, too. For those of you that are returning, welcome back. I hope I have some more information that you can use to help improve your treatment. And to those of you that are new, I'm glad you're here for the first time. The way these webinars work is you get to create the webinar. And the way you create the webinar is with your questions. So if you have a question, write it to me in the chat box that is at the bottom of the screen on the right-hand side. Please, as you write your question, just hit enter at the end of your question. When you hit enter in the middle to create paragraphs, it doesn't create paragraphs. It just results in multiple questions coming to me, and it makes it harder for me to present your question, okay? During the webinar, if I take your question, I will post it on the screen so that you can see it. And I will read it, though, because on the recorded version of the webinar, the questions that I post on the computer screen don't show up. So I read it so that those that might tune in tomorrow after the recording is done get a chance to understand what that question was, too. I am recording the webinar, as you just heard. And tomorrow morning, all things, if everything works correctly, sometimes it doesn't, but if it works correctly, tomorrow morning you will get an email from me saying the recording is available. I will have created a page for it at our treatlyme.net site, and so you should get the link to that and be able to come and watch it again if you happen to miss some of the information tonight that you'd like to review again tomorrow, okay? And also in there, I probably will have the links to sign up for the next series of webinars that will begin about 2 weeks from tonight. So anyhow, I think that's the kind of the bookkeeping end of things here. What else? Oh, yes. During the webinar tonight, we're going to, oops, hold on a minute. Something's happening here. Oh, I don't understand. Something's happening on my computer screen I haven't seen before in this webinar room, so I'm not quite sure what it means. Bear with me here. I'm just getting rid of that. All right. So let's, with no further ado, let's go ahead and get started. I'm going to take the first question. The way these questions work, by the way, I usually will try not to take more than one question per person. I will get through as many questions as I can. I will not get through all of them. And generally what I'm doing is I'm posting the question and reading it for the first time that you are looking at it as well too. So let's go ahead and, well, Kate asked a question. She says, how long will the webinar go for? It's usually an hour and a half. And tonight I do plan on it going for an hour and a half unless for some reason I just poop out in the middle of it, but I don't think I will. All right, so the next question is from Marlene. Hi, Marlene. Welcome here. Should I take a break after a certain amount of time on curcumin and ashwagandha during a Lyme Bartonella treatment, or are they safe for the long haul? And you're welcome, by the way. So everyone, curcumin I use to decrease inflammation in Lyme. I use it to decrease a group of inflammatory chemicals made when you have a chronic Lyme infection called cytokines. And as many of you may be familiar, cytokines, at least from reading some of my work and also being on the webinars, basically cytokines are what give you your Lyme symptoms. They're good and they're bad. They're produced by white blood cells to help fight infections, any kind of an infection. They're designed to turn on the immune system. But in Lyme disease, the immune system does not do a good job getting rid of the infection, and eventually it makes too many cytokines. Too many cytokines are what give you all of your Lyme symptoms. So when somebody says they have Lyme symptoms, what they really have are excess cytokine symptoms, okay? And we want to lower them. And a good way to do that is with curcumin. It's a component of the Indian seasoning turmeric. It's a 500 milligram pill. You take one pill 3 times a day. You lower it to feel better, but you also lower it because getting those cytokines down will also help your immune system work better too, okay? Ashwagandha is an Ayurvedic East Indian herb, Chinese medicine herb. It's been used historically in those forms of medicines for thousands of years because it's observed to give better energy. And what we know from animal studies is that it does help the adrenal glands and even the thyroid gland work better too. So I build it in as part of one of the core parts of my treatments. It's something called an adaptogen. And it is usually recommended as a 400 milligram pill, 2 pills in the morning and 2 pills between 1 and 2. Okay, now you can find more about both of those herbs in my Lyme disease treatment guideline called the Successful Treatment Recipe. Is basically all the components you should do in the middle, at the beginning, towards the end of your Lyme treatment. It addresses all the imbalances that can happen in Lyme that are critical to correct so you can get better. Getting rid of Lyme and even Bartonella is not just about poisoning your germs. We need to recruit your immune system and your hormonal systems and all the systems in your body to help fight this invader, basically, okay? So anyhow, can you use curcumin and ashwagandha throughout your treatment? Yeah, I'll have people be on it for a year, 2 years, because I use it to kind of set the floor of the treatment, okay? So I have no problems with people being on those long term, all right? So for those of you that aren't familiar, I'm just going to do a quick screen share here, and I'm going to show you where you can learn more about these. All right, so let me go here. All right, so this is our main Lyme disease information site. This is the Treat Lyme and Associated Diseases site, okay? And down here on the left-hand side, there's a Lyme Guidelines tab, all right? So you can just click on that. This is a free resource. You can read through the treatment guidelines that we have, and it includes some basic things like getting sleep. But here is that section on cytokines I was just telling you about. And then here is what's known as an adaptogen, which is that ashwagandha that I was telling you about as well, too, okay? All right, so you can read more about those here in the Successful Treatment Recipe. So let me go back here again. Okay, Marlene, thank you for that question. All right, let's see. This is from Kevin. Hello, Kevin. I did a saliva test and my abnormal results were estradiol 3.7, estriol 88.7, cortisol 19, noon, let's see, wait a minute, 19, or cortisol AM 19, noon 3.8, evening 1.5. And at nighttime, 0.55, I should say. Let's see, the rest of my hormones are within range. Do you have any recommendations to lower estrogen and correct these cortisol levels? You know, I really don't have good recommendations on the estrogen for you, Kevin, unfortunately. Regarding the adrenals, you need to balance them. Your morning number is probably okay. I usually like to keep those at about 16 or higher, but you are getting lower in the afternoon, which is a sign of adrenal fatigue, especially as the day goes on, you poop out more. And so what I like to use for that is the adaptogen I was just talking about earlier. That's that ashwagandha. So ashwagandha does support the adrenal glands to do what they're supposed to do. It doesn't replace their function. It helps them work better, okay? And again, that's a 400 milligram pill. You want to do 2 pills in the morning and 2 pills between 1 and 2. Other ways you can support your adrenals, I don't like using. And so you may see, for instance, that integrated medicine physicians and naturopathic doctors work with something called ginseng. They might work with rhodiola. They might work with something called cordyceps. The problem is that those herbs tend to be, those supplements and herbs tend to be a little bit too energetically hot. They can make a person jittery. Versus ashwagandha kind of comes in energetically neutral. It will lift you up, but it's not going to make you jittery, okay? So I tend to prefer using ashwagandha in these situations, all right? If you want to read more about ashwagandha, let me go ahead and just do a quick screen share here for this one. Okay, so I'm going to go over here to our, this is the Treat Lyme book. This is our resource, the various things you can do to address Lyme disease. And we break it down by systems, okay? So there's things you can do for the bladder, for instance, okay? What do you do about helping the immune system work better? But one of the things that we have is a section on hormones. And this is our chapter on hormones. And in here is an article about ashwagandha. So if you want to read more about ashwagandha, some of these things I'm talking about, you can find it within the Treat Lyme book, okay? All right, so let me go back here again. Somewhere I'm going back here again. Let's see. There we are. I'm back. I got lost on my computer there for a minute. All right, thank you for that question, Kevin. Hello, Linda. Let's see. I was wondering if it's okay to test for co-infections while on antibiotics, or should I stop for a few days to test? If so, what type of test do you think I should select? Babesia microti by real-time PCR, or Babesia microti IgG, IgM by ELISA, or both? Okay. It's a good question. Okay, so when you, everyone, what a Babesia PCR test, or a PCR, because we can do Bartonella PCRs, we can do Lyme disease PCRs. A PCR test is a test that's designed to look for the DNA of the germ. In other words, if we draw your blood and we find the DNA of the germ, that suggests the germ is living in you, okay? And PCR is a method that we can use to amplify the DNA, because sometimes when you get DNA, it's just a small piece, but you need to be able to see it better. And so there's an amplification technique, which is called PCR, which stands for polymerase chain reaction. It's one of those strange terms we come up with in medicine, but it's a way of amplifying the amount of DNA so you can read it, okay? So to do a PCR, to see DNA in the blood, you want to make sure that you haven't killed the germ so that you can't find it in the blood. So probably if you're going to do the PCR test, it's probably better to not be treating the Babesia. Other antibiotics are fine, but to use Babesia antibiotics, you probably don't want to do it if you're going to do PCR. On the other hand, the IgM and IgG are antibodies, and they're basically an immune system reaction that will continue on even if you've been killing the germs, okay? So presumably then doing an IgM and an IgG is okay to do while you're on the antibiotics. There's not a problem with that. However, I don't believe in testing for the co-infections when it comes to Babesia and Bartonella. And the reason why I don't like testing for them is the PCR testing really is not that good. And the IgM, IgG testing is only useful for maybe 2 strains of a potential 15 to 20 strains, okay? And because the testing is really so poor, generally what I'm going to do is I'm going to make my decision to treat for Babesia. And same thing with Bartonella. We estimate 30 strains of Bartonella, and PCR testing is really not that good. And the antibody testing is not that good because we only have antibody testing for maybe 1 or 2 strains. So therefore, I usually make my decisions to treat for Bartonella and Babesia based on what the clinical symptoms tell me, okay? So for instance, symptoms that suggest Babesia are drenching night sweats, panic attacks, air hunger, racing or skipping of your heart, headaches in the front of your head, maybe some increased deja vu experiences, sometimes nasal congestion or coughing. Those are symptoms that make you wonder about Babesia. If you have a number of those, that can suggest Babesia. And so based on clinical presentation, I'm going to decide, yep, sounds like Babesia. We're going to treat for Babesia, okay? Bartonella, on the other hand, has its own set of symptoms. You think of Bartonella when somebody has cognition, thinking problems significantly worse than energy problems. That's one clue that you could have it, although sometimes they're relatively as bad as each other, okay? Pain on the soles of the feet, increased daytime sweating, bladder irritation can sometimes be part of it. Restless legs, got to move your legs around a lot. Anxiety can be a big part of Bartonella. Pain on the soles of the feet, I think I just mentioned that one. Neurologic sensitivities like sound sensitivity, light sensitivity. Those are things that make you wonder about Bartonella too. So again, I make my decisions to treat based on what the symptoms tell me in that regard, okay? So I have a whole article about this too, and I just do a quick share so you can take a look at it later. It's in the section about how to diagnose, okay? So there's a chapter we have called How to Diagnose, and within here you can see the article. It's called, the one I would point you to is this one called it could be Bartonella or Babesia, the signs and symptoms, okay? So I talk about why testing isn't useful, and again, I list out what the various symptoms are that would make me want to treat for Bartonella or Babesia, okay? It's part of that article here. All right, let me go back here. Thank you for that question, Linda. Good luck to you. Hi, Dr. Ross. I've been working out with a personal trainer for the past few months, mostly weight training and some cardio. I'm doing pretty well. He suggested I start taking creatinine monohydrate to increase strength gains. When I asked the PA at my doctor's office, she recommended research nutritional, and I'm missing the rest of your question. I suspect there's a second part here somewhere. You know, Debbie, I'm not finding the rest of your questions. I don't have a comment, actually. I need to know more what it was. If I find it later in the question list, I'll go ahead and see if I can respond then, okay? Hello, Nina. Let's see. Hope you are feeling better. Yeah, I had to leave the webinar a little early last week, everyone, but I am doing better. Thank you very much. Do you feel that IV antibiotics are more effective than oral antibiotics? Yeah, but not much. And I generally don't think it's worth the risk of doing the IV antibiotics. So this is what I see. And this is what regarding the Lyme infection, okay? So oral antibiotics, any oral antibiotic combination, because you got to take at least 2 antibiotics to adequately treat for all 3 forms of the Lyme germ. Any 2 prescription oral antibiotic combinations will work about 85 to 90% of the time. In my experience, IV antibiotics work about 90 to 95% of the time. In other words, they're relatively close, okay? Now, there are risks in doing IV antibiotics. You got to get an IV line put in and left in place, and that's something called a PICC line. Now, PICC lines basically go into your biceps muscle here, and they're fed through a vein in the biceps muscle until the end of the line comes out in a big vein right up here above your heart, okay? The other way to do an IV line is to do something called a central line, which goes here in your chest, and it's tunneled under the skin and put into a big vein up here by your collarbone, and it also ends here at the tip. Okay, so the problems with PICC lines and what we call central lines, that's the ones that go up here, is that there's a risk of getting infection in the tube, which then gets into your bloodstream, so you can get a blood infection. And the other risk of doing them is that you can get blood clots that form at the tips of the line. And those blood clots rarely can break away. And when they do break away, they can float into your lungs. And that's something called a pulmonary embolism. And pulmonary embolisms can kill parts of your lung, and rarely, they might kill you, okay? Now, the risk of getting a pulmonary embolism, or I should say blood clots, or getting infection seems to be about 15% over a 6-month period of time. As I've looked at the science on this, basically about 15% of the time that I have somebody that has a PICC line in or a central line in, if they develop one of those problems, I'm going to have to remove the line. And that happens about 15% of the time. Now, there's 2 schools of thinking in the United States, and I'm not familiar enough with what goes on in the rest of the world, but here in the States at least, there is what I call the East Coast school of thinking regarding Lyme and the West Coast school, okay? I'm on the West Coast, okay? I'm out in Seattle, Washington. The East Coast school tends to start with IV antibiotics a lot more often than what we do here on the West Coast. Most of us out here on the West Coast tend to go orals first, unless there are certain situations where people are having rapid deterioration in front of us, or they have heart block going on, or they have rapid neurologic decline, or huge central nervous system, brain neurologic decline. Those are situations I might start with IV first. Out on the East Coast, they tend to go with them right away. I think we do just as well as what they do on the East Coast, although we've never had studies to say, is it best? Do you get as good results long-term out of orals or with the IVs? My observation is when you do IV versus oral, I don't think you get there any quicker than doing oral. Although you may have a 5%, slightly better chance that it's going to work, 5% better chance, okay? So generally, I tend to work with oral antibiotics with my patients. There are some times I will go for IV, but that's kind of my the discussion that I'll have with my patients. Yes, might work better about 5% of the time, but you carry a 15% risk or so that over a 6-month period of time that you're going to have that PICC line or that central line removed because of either a blood clot or an infection in your bloodstream, okay? Now, there's 2 other risks you need to consider too. The risk of not having insurance company reimburse you, okay? And that's a huge risk. The infectious disease doctors, because they have been great at promoting their bad opinion that IV antibiotics and treating Lyme for more than a month are not required, often insurance companies will only pay for 1 month of antibiotics, and you're going to be stuck having to pay the cost of that, okay? So that is an additional risk that you should bear in mind as you're considering whether to do IV antibiotics or not to. All right. Thank you for that question. Excuse me, everyone. I'll make a quick note to myself there. Okay, so let's see. Next question is from Pat. Okay. Let's see. Hi, doctor. Are you familiar with other antibiotic type therapies? Roadback, CPN help, inflammation therapy, etc. If so, can they also be used for or in conjunction with Lyme? In my research, I noticed there's many that seem variations. Just curious. Thanks much. It's interesting. I don't know the roadback one. I think what you mean by CPN help would be treatment for chlamydia pneumoniae, possibly an inflammation therapy. I don't know the specific names that you're referring to here or what is involved in those protocols. I suspect if you and I were to have a conversation, you were to tell me what they are, that I would be able to comment. But unfortunately, I'm not going to be able to comment here. Okay. All right. Good luck. Hello, Jackie. Let's see. Lyme, Babesia, or Bartonella. Why are symptoms worse during a woman's period? I am in a good deal of pain at this time. Bad menstrual cramps, worsened migraines, and neck pain. My entire back and much of me hurts more than other days. Any advice for a woman at this time to lessen pain and function better? I've had swelling for many years in the glands above my jawline. This was very swollen during my period. Is it relative to the worsening symptoms? Thank you. Okay. So, Jackie, I'm going to go back and repost the first part of your question because I think I'm just going to leave that up on the screen so everyone can see at least what we're in the ballpark about talking about here. So it's common for women that during their period that symptoms will get worse. I think it's more related actually to the Lyme infection. And there probably has something to do with hormonal changes and how it relates to inflammation and maybe even a suppression of the immune system that can happen. Although I don't have a solid idea for why that happens, okay? But it is very common for women during periods to have worsening of the symptoms. I don't have a good approach, basically. For me, what I usually do is, in other words, to target just that problem. Basically, what I would suggest, make sure you're doing all the basic steps. Make sure you're doing the curcumin that I mentioned in the successful treatment recipe. Make sure you're on a good adaptogen like the ashwagandha, okay? One thing that I will sometimes try, because also when you get into outside of Lyme, one of the reasons that a woman can have, feel worse during their period is also hormonal variation. And one of the things that can help with that is vitamin B6. Sometimes I'll try B6. You take it every day, 50 to 100 milligrams one time a day can often make it so you don't get the worsening of symptoms or premenstrual symptoms, any kind of symptoms during your pregnant or during your period. Sometimes being on B6 going into it can help. You would take those all of the time. I haven't found benefit by doing any hormonal manipulation, like being on estrogen or progesterone for women. The best you can really do is to try to be on B6 and make sure that you're doing a good job with your cytokine control going into your cycle. Okay, all right. That would be with the Mariva 500 curcumin, which is curcumin, 500 milligrams, and I might even bump it up to 2 pills 3 times a day from that 1 pill 3 times a day that I often have people use. All right. Good luck to you, Jackie. All right, let's see here. Hi, Marcia. Let's see. I'm wondering if you knew about Morphia and if you believe there is any connection to Lyme. You know, I don't know if there's any connection to Lyme. And I guess that's the best I can say about that. All right. I'm getting stumped tonight by your questions, it looks like, in some instances. Hopefully we can get in some ones that have better answers for you all. Hello, Lisa. Let's see. My doctor just took, or my D, just took her first transfer factor Lyme Plus. 3 hours later, completely hysterical. Is this normal after only 1 pill? Suggested to continue. Thoughts on charcoal? Can it be given via feeding tube? Thanks so much. You know, I haven't seen that happen with the transfer factor Lyme Plus. So everyone, what transfer factors are a protein that is made by the immune system. And for the sake of describing what it is, I want to talk about, I'm going to divide the immune system into 2 parts, okay? For the sake, and this is a very simplified explanation, okay? So transfer factors are made by the detective part of the immune system, and they're designed to help turn on the army part of the immune system, okay? So the detectives can detect what kind of germ is there, where it is, but they're not prepared to go ahead and fight the battle. And so they have to give signals to the army part of the immune system. And one of the ways they do that is with these substances called transfer factors. So transfer factor Lyme Plus is a transfer factor mix that has in it transfer factors for Borrelia, which is Lyme, Bartonella, Babesia, Chlamydia pneumoniae, Mycoplasma pneumoniae, and 3 viruses that you can sometimes find active in chronic Lyme called human herpes virus type 6, cytomegalovirus, and Epstein-Barr virus. Epstein-Barr is the monovirus, okay? When I look at what's in it, I don't see a reason that it would cause something like hysterical, what you're describing here. I don't know, therefore, because whether charcoal would help it or not. And the one thing I would say that I've learned in managing this illness is that there are the typical things that can be common side effects, okay? But anything can happen. And so one of my statements is anything can happen to anyone with anything. And sometimes that means unexplained things. So at this point, I would wait until this goes away. This is a very atypical reaction that you're describing. You might want to try it again in the future after this is gone to see if you recreate the situation again. But you might want to do it by taking half a pill instead of doing a whole pill the next time. Okay? All right. Good luck. All right. Hi, Debbie. Let's see. Hi, Doc Marty. Do you have any suggestions about managing side effects from cholestyramine-associated nausea? Also, have you seen tinnitus as a side effect of IV Zithromax? Thanks so much. So tinnitus, Debbie, tinnitus can be a side effect of oral Zithromax, as well as it can occasionally occur with IV Zithromax too. My experience is it goes away as the Zithromax has stopped, though. I haven't seen it to be a permanent injury, all right? That doesn't mean it can't be. In my experience, though, and I use quite a bit of IV Zithromax in my practice, I haven't seen it be a permanent injury when it happens, okay? And then regarding nausea and cholestyramine, there isn't necessarily a good way. Some things you might try, you could try ginger tea. Ginger is a useful anti-nausea medicine for any kind of a nausea situation. In fact, when I am a family physician, and I used to at one time deliver babies, and one of the ways that I would manage nausea and vomiting during pregnancy was with ginger tea. It can be quite useful in that situation. I find it useful in other situations of having nausea. A good way to make ginger tea, you can do your tea bags, or you can make it from scratch. And when you make it from scratch, a really potent way to do it is to get ginger root. You don't need to skin it. Cut it in about 1/4 inch to 8-inch slices. Take a handful and put those in about 2 cups to 3 cups of boiling water. Boil them for 10 minutes. That makes a great extraction. And then you can chill it if you want to, put it in the refrigerator, just have it available to sip on periodically if you get nausea, okay? So that's one suggestion. Another suggestion you could try, because sometimes it can be to just irritation of the lining of the stomach, would be to try some deglycerated licorice. So licorice with the glycyrrhiza group removed. Glycyrrhiza can lead to high blood pressure, but it's licorice with this chemical group called glycyrrhiza removed. And it comes as licorice tablets, usually 300 to 320 milligrams. And you're going to chew 2 of those before meals about 3 times a day. Sometimes that can help with nausea, but I'd probably go more first with the tea, okay, that I described. And then if that doesn't work, you can always do the pharmaceuticals like Phenergan or Zofran, for instance, too, okay? All right, Debbie. And I hope that your daughter's not having too bad a time with the ringing in the ears, or if you have started it, I hope the ringing, or I hope if you're not on it, she's not having ringing in the ears, and then when you start it, she doesn't have problems with it, okay? All right. Good luck to you. Hello, Saki, and I wish I knew how to spell your name, how to pronounce your name. I'm sorry about that. I think you were here last week as well too. Hello, Doc Marty. Let's see. I have increasing floaters in my eyes. What causes this, and is there anything I can do about it? Thanks so much. So floaters is a very common symptom we'll see in Lyme. I don't have a good explanation for why it occurs more often in Lyme, but I do see it occur in Lyme. It also occurs in healthy people. Generally, though, as we get your Lyme under control, the floaters will go away. They'll get better, okay? And so what to do about it is there's no quick fix. The long-term fix is to treat that, to treat your Lyme, okay? All right. Good luck to you. Thank you for that question. All right, let's see here. Hello, Lori. Good to see you again. Hi, Dr. Ross. Does lithium orotate help with all pain or only neurological? Can it be taken in an empty stomach? Thank you. Okay, so everyone, lithium is a mineral that is used inside of nerves. I'm sorry, is an essential mineral that is found in our nerves, okay? And it helps with nerve function. I use it at very low doses as a product called lithium orotates 5 milligram pill. And a person would take it as 1 pill 3 times a day, okay? And what it does is it helps calm an agitated nervous system. We know from studies that it helps with something called nerve signaling, which is the ability for nerves to talk back and forth with each other. Lithium can also be used in psychiatric illnesses, but usually when we use it in psychiatric illnesses, a person is going to take somewhere between 600 to 900 milligrams at a time. And as what you could just tell from what I was just saying, I have people take it when I'm going to use it more at 15 milligrams total a day. So lithium orotate 5 milligrams 3 times a day. I use it because it can help with thinking, helps improve cognition. It also can help calm a very agitated nervous system, so anxiety, for instance. Now, does it help with neurologic pain? I really haven't seen it to do that. And that's not one of the, I wouldn't generally recommend it for neurologic pain. I haven't seen it as something I use that is beneficial in that kind of a situation. Okay. If you are using it for other reasons, though, like to improve your thinking or like to calm an agitated nervous system, you're fine to take it, and you can take it on an empty or a full stomach. To me, it doesn't matter how you take it in. All right? All right. Thank you for that question. Let's see here. Hello, Mary. Hold on just a minute. I got to drink a sip of water here, man. All right. Let's see here. All right, Mary. Let's see. I've heard that there is some correlation between Lyme, MS, and Alzheimer's disease. Is there any relation between ALS and Lyme? A person I know who went undiagnosed with Lyme for 10 to 12 years was recently diagnosed with ALS. Could you discuss the diseases and any connection to Lyme? Thank you. Okay, so multiple sclerosis and Parkinson's disease and Lou Gehrig's disease, also known as ALS, amyotrophic lateral sclerosis, ALS, all can be caused by Lyme. All right. Now, that doesn't mean that all ALS is Lyme. It doesn't mean all Parkinson's disease is Lyme. And it does not mean that all multiple sclerosis is Lyme. But in some, those illnesses are actually caused by Lyme. It is also possible that some people have two illnesses. They have Lyme disease and they have ALS. And how do you figure out when they have Lyme and ALS if it's all Lyme and not ALS caused by another problem or not? There's no way of knowing, all right? So you have to realize when we say multiple sclerosis and we say ALS, these are basically what we call neurologic constructs. In other words, there are certain symptoms that we expect a person to have, and there are certain findings that we might have on MRI testing, for instance, and in the case of ALS, on something called an EMG test, which is a test where needles and electricity are put into your muscles and a reaction is watched with what happens in your nerves, okay? So, but they're neurologic constructs. It doesn't tell us what causes them. So yes, Lyme can be one of the causes, okay? And if your friend if he was recently diagnosed with ALS, but may have had Lyme for 10 to 12 years, usually ALS, people are going to have really rapid declines. If his decline doesn't happen rapidly, that tends to be a little bit more what we see with Lyme that is masquerading as ALS, okay? So yep, they can be, ALS can be caused by it, MS can be caused by it, Parkinson's can be caused by it. These are situations when people have these that I'm going to tend to go for IV antibiotics, just so you know. That question came up earlier tonight, okay? All right. Thank you for that question, Mary. All right, let's see here. Hello, Gloria. Let's see. You're welcome, by the way. Thank you for that comment. So happy to have you helping us through healing. Thanks. Would like to know what you think about hydroxychloroquine for treating Lyme, and do you have an opinion on how long it should be taken? Okay. So everyone, hydroxychloroquine also goes by a name called Plaquenil. Okay, and it's an old malaria medicine, actually. And so it's a quinine-like medicine, or it acts like quinine. It's a quinine derivative. It does not do any good against malaria, so we don't use it for that reason anymore. Now, in Lyme disease, it can be used for a number of reasons. So first of all, Probably the number one prescribers of Plaquenil these days are rheumatologists. So Plaquenil seems to have an ability to lower inflammation in inflammatory arthritis. And so that's why it's predominantly used in those illnesses. And so sometimes it might help with some of the inflammation that's going on for people that have Lyme disease too. But in Lyme, there's a few other reasons I'll use it. So one of the things that Plaquenil can do, in addition to helping with pain, is it helps lower acid levels inside of cells, inside of an area of our cells called vacuoles. Vacuoles are like caves inside of your cells, and inside the vacuoles is where intracellular Lyme lives, okay? And it creates an acidic environment in there, and that acidic environment can deactivate our intracellular antibiotics. And so those would be the antibiotics that treat intracellular Lyme. Those are the tetracyclines like minocycline, doxycycline, tetracycline, and also your macrolides, which is Biaxin and Zithromax, all right? And so what we can do sometimes is use Plaquenil, because Plaquenil helps to make those vacuoles more alkaline, more basic, less acidic, okay? And so it can help. You can sometimes use it. I may sometimes use it if I don't think that a person's getting enough oomph out of a Zithromax or maybe a Biaxin. I might add it in. I don't use it that often. If I'm going to use it on any of it, it's probably for Zithromax, because of those 5 I just mentioned, Doxy, Mino, Biaxin, and azithromycin, Biaxin's clarithromycin. Of those 5, the weakest one in managing adult Lyme is Zithromax, and so sometimes I will think about using it for that. Now, some of my colleagues will use it because they think it treats cyst Lyme as well too. But what I want to let you know is there's competing studies about that, okay? So there are some studies that show that on the Petri dish that cysts will get taken care of by that Plaquenil. However, there are competing studies that shows it promotes cyst. So I made a decision probably about 4 or 5 years ago to stop using it as an anti-cyst agent because I really can't tell. And I've got other options I can use to treat the Lyme cyst, okay? Then finally, sometimes I may use Plaquenil because it's a quinine-like medicine as part of my Babesia treatments. I sometimes will add it in to my Babesia treatments, all right? So if you're more interested in seeing, anyhow, those are my thoughts on it. So yeah, I do use it. I will not use it as an anti-cyst agent. If your doctor is using it for that purpose, or ask them why are they using it. If they tell you for cyst, I wouldn't do it. I wouldn't recommend it. If they're using it because they think it's going to help your Biaxin, Zithromax, minocycline, tetracycline, doxycycline work better, then I think that's a good idea. If you do use it, usually I'll use it at 200 milligrams twice a day. If you start using it at higher doses, you should have eye exams on a regular basis, about every 6 months, because at higher doses, above 200 milligrams twice a day, Plaquenil can lead to retinitis, which is inflammation of the back of your eyeball. And you need a screen for it, okay? But that doesn't happen at the doses of 200 milligrams twice a day, all right? And there's science that shows that as well, too. So I usually don't get eye screenings done when I wind up using it, all right? All right. I hope that gives you the information you need. Thank you for that question. Hello, Josephine. Let's see. What do you think of low-dose immunotherapy? Dr. Ty Vincent developed it. He treats Lyme as an autoimmune disease and uses low-dose antigen exposure to lower the body's hypersensitivity to bacteria. If this works for symptom relief, do you think it is okay to leave the bacteria in the body? This is a very interesting question, and I'm trying to figure out what my full position is on it. I've been looking into it here lately. Hold on just a minute. I'm really thirsty tonight. Just a minute. Okay, so low-dose immunotherapy is one of the, I guess, newer, what I would call IT treatments of the Lyme disease world. And we come up with what I call the IT treatments. There's a new one that comes up quite often. So these are the things that somebody discovers might give them benefit, and then suddenly everyone starts trying them, okay? And usually we find out over time that most of these are not all that they're cracked up to be. So I'm always a little cautious on the IT treatments, just because they're the IT treatment, okay? But this one is interesting to me, and I'm thinking more and more about it, that it might be something that would be okay to do later in your treatment if the standard things that we do, like killing germs and balancing hormones, etc., aren't getting you better, then this might be something to consider doing, okay? So low-dose immunotherapy does do injections of very low doses of what you're trying to get rid of. And it's a way of down-regulating an overactive immune system, okay? So there's an idea that the reason that people have Lyme symptoms is really an immune system reaction, which isn't unfounded. As many of you know, I say that the reason you have Lyme symptoms is that your immune system overproduces cytokines. That's an immune system reaction, okay? But this theory says that it's even more than just the cytokines that's out of whack, it's your immune system as a whole. Now, I have concerns about using it because I really don't want to turn off the immune system, which this could potentially do. You want the immune system attacking the Lyme germ, all right? We don't want to get the immune system so it's not attacking Lyme and then have it grow more. And all we've really been doing is managing the symptoms while Lyme has been progressively getting worse in the background, all right? So as I'm thinking about this therapy, and I have no science, they have no science either. The people that advocate doing this have no science about what the long-term implications is and doing low-dose immunotherapy, or it's also called LDA. There's no science that says over the long haul, do people given LDI, maybe their symptoms get better, but down the road, do they actually do a lot worse? And that's what my concern would be. So lately I've been thinking about this, and I think what my position is I'm not an advocate for it unless you first have gone through a significant part of your treatment, say a year or 2 years of antibiotics, herbal antimicrobials, or whatever germ killers you're using, okay? Go through that for about a year or two, and only then, if you're not getting better, then it is possible that what you're looking at is more of an autoimmune illness triggered by having Lyme in you. Maybe the germ really is under control, and maybe it's okay to then go ahead and do your low-dose immunotherapy, all right? Many of you may be aware that there's another treatment that I talk about doing at about 6 to 9 months into treatment if you're not getting better, called low-dose naltrexone. Low-dose naltrexone is another way of regulating an immune system that might be overactive. But I don't advocate using that either until about later in the treatment, okay? Because again, same concern. I don't want to turn down an overactive immune system that might actually be helping us, all right? But the truth is, we have no science here. I do believe that you get better symptoms by being on it. I'm not clear, and I don't think it's a good idea to do early in your treatment. I think you want to have your immune system working strongly. But that's opinion. I have opinion. I don't have science to guide it here, or do they have science to guide it either too? I'm concerned about the long-term implications, so, okay? All right. Thanks for that question, Josephine. Hello, Sarah. Let's see. Do muscle and joint pains, which are common in Lyme, always migrate around the body, or do they eventually reside in specific places if they are not treated with antibiotics? It's a good question. So it is very common, as most of you know, to have, or probably everyone listening in tonight knows, to have joint and muscle pains as part of Lyme, okay? That's kind of like one of the hallmark symptoms that most people are having. They're going to have some degree of joint and or muscle pain. It's a common pattern, though, in many, especially earlier in the illness, before it starts settling in a little bit more, or until they get further down the line in the illness, that the pain migrates. So one day it's your right shoulder that hurts, the next day it's your left knee that hurts, okay? So you can get wandering pain. That's very unique to Lyme, and it does happen in Lyme. My experience, though, as I hear the stories of people where that happened, is it's a symptom that's more early on, but eventually it does become more persistent and will eventually reside in certain areas, okay? That inflammation will get more locked in certain areas, all right? Do I think, so yeah, I do think you should treat Lyme. If you've got Lyme, you've got wandering pain, I do think it's a good idea to treat that, and maybe it will prevent it from becoming more of a locked-in kind of pain like you're describing here too. All right. Thank you for the question. Hello, Sue. Let's see. I have been dealing with cystic Lyme since October 2015. Finally diagnosed after 6 months. My current protocol for treatment is Zithromax in the morning In the PM, I take Omnicef. On the weekends, I take Tindamax. Recently, I have developed ringing in the ears. Any suggestions on how to treat this? All right. So this treatment that Sue is using of working with Omnicef and Tindamax and Zithromax is designed to treat all three forms of the Lyme germ, all right? So those three forms of the Lyme germ are spirochete Lyme, that's the corkscrew-looking thing that many of you are aware of that we see in Lyme, all right? That's one of the forms of the germ. There's another form of the germ that moves inside of the cells and lives inside of your cells. We call that intracellular Lyme. And then there's a microscopic cyst form of the germ. We think that as you treat spirochete and intracellular Lyme, some of those forms may convert over into the cyst, okay? Now, there's some newer research that's challenging the idea about whether we truly have a cyst, and maybe what the cyst really is are pieces that break off of the spirochete, all right? So it may change how we go about treating. Do we have to use these harsh medicines like tinidazole, Tindamax that you're on, to treat cysts, although clearly they do seem to work. We've got evidence that regardless of whether they're a bleb that comes off of a spirochete or whether there's truly something called a cyst, a separate entity, the Tindamax has been shown to work on Petri dish experiments, so we do know it works regardless of whether we call it, okay? Now, of the antibiotics, so the way that Omnicef works is it basically prevents the spirochete from repairing damage to its outer membrane, which over time results in holes developing, and eventually the germ grows, the germ bursts because it's not held together by its covering, all right? Zithromax gets inside of the spirochete and also inside of cells and limits protein production, so the germ can't grow as well. And then finally, Tindamax works inside of the cyst and can also treat intracellular Lyme too, all right? Now, this treatment approach that you're using, of these antibiotics, the three of them, the one that potentially could give you ringing in the ears is the Zithromax, all right? And as I answered a question earlier tonight, one of the things I said is that it can do it. I don't find it to be of a permanent nature, so if you're on it, stay on it. Generally, I don't find it. I haven't seen it to be a permanent nature. I can't guarantee it, though. But in terms of what you can do for it, that's an interesting question. So one of the things I have tried for it is ginkgo biloba, which is an herb. It's Gingko. Second word is Biloba. It's an old-time naturopathic treatment, natural medicine treatment that increases blood flow by making blood cells a little bit more flexible so they can flow deeper into small blood vessels, okay? They can get more deeply, they can get to the nerves that are being injured. The ear nerve, for instance, is being injured. That's giving you that ringing in the ears. You want to take it as 80 milligrams twice a day. It can help. I get mixed results with it, but sometimes it can help, okay? Yeah, I think that's the only comments I want to make about that, all right? All right, Sue, thank you for that question. All right, hello, Carol. Let's see. Thank you, Dr. Ross. I got bitten in 2014, live in high infest area in Quebec. Chronic fatigue, sweat, slow digestion, pain, dizziness, ELISA test negative. Doctors don't want to help me. I'm basically trying to heal myself. Would bioresonance help? You know, I don't find good results with bioresonance. It might get some symptom relief, but I don't think you're going to get at the germ altogether, okay? In terms of what you could do on your own without getting help, well, there's actually quite a bit. One of the things, Carol, you might want to take a look at would be our successful treatment recipe and follow it, all right? So look at the ideas we have for sleep. Look at the ideas we have to lower cytokines, to correct your hormonal problems, to be on a good multivitamin. You could work with the herbs Banderol, Cemento that work 85 to 90% of the time to treat Lyme. If you have Bartonella, we've got some, I have recently rewritten the Bartonella article to now give you an idea on some herbs that I find that work 75% of the time. That's called Kills Bartonella. And if you have Babesia, there's decent herbal options you can use for that. That article is called Kills Babesia. a brief guide. The one on Bartonella is called Kills Bartonella, brief guide. And then the herbal regimen you would use for your Lyme is Banderol Cemento, and you can find information in our Treat Lyme book about that, okay? So you could design a whole treatment using the successful treatment recipe that I showed everybody tonight, which I think works better than the Cowden protocol, because Cowden doesn't correct enough things. Cowden's good at maybe killing your germs, but he doesn't create enough balance through all the other problems, okay? And I think from what we see, it works better than the Buhner herbal regimen protocol too. And then finally, Carol, I'm going to show you these resources in a minute. Actually, I'm going to go ahead and do a screen share now. I want to show you one other thing you might consider too. Okay, so I'm back here at our Treat Lyme and Associated Diseases site, of which the big part is the Treat Lyme book, okay? But again, down here at the bottom on the left-hand navigation menu, one of the tabs you might want to look at is this one called Online Consult, okay? So this is a service that I run where I can visit with anyone from across the globe, and I do. I actually help people in the United Kingdom. I help people in Australia. I help people in Canada. This is a way that I can help look at things with you and give you ideas on what to do about your treatment. Now, sometimes some of the recommendations may be things that you might want to try to see if you can get a doctor prescribed, but I understand that might not be a possibility. But I'd be able to help sit with you over the course of an hour in an online video visit and help come up with some treatment recommendations for you. So for instance, do you have Bartonella? Should you treat it? Do you have Babesia? Should you treat it? What about your adrenal fatigue? What should you do for that? Okay, so this is a place, it's usually an hour visit. I could help you design a whole treatment program that you could put into place by yourself. And then we could visit periodically, maybe once every month, once every 2 months, and I can keep helping you with your care. The only thing I cannot do in these type of visits, though, is I cannot prescribe for a person and I cannot order a test because my medical board would not allow me to do that. The licensing body would not allow me to do that, okay? So for any of you that have questions that are too extensive for me to deal with tonight, or you need help, maybe even augmenting the care that your physician has been doing with you, you're wanting to know some additional things from an integrative medicine standpoint, the way I work that can help, or you want me to help design a treatment for you, this is one way to do it, okay? All right, so take a look here. If you have any questions, you can write to us, you can give us a call. Take a look at the how it works section so you understand what you're getting into, and then look over the disclaimer form, a consent form that we have, okay, so that you understand how this works as well too. All right, so this is one option for you. All right, then I did mention in terms of you should design your treatment yourself, and I think you can do better than bioresonance, all right? Take a look at this successful treatment recipe where we talk about the various things that you want to do, all right? And in here, you're going to see all the way I'm scrolling down through it. These are the basic steps anyone should do in their Lyme disease treatment, okay? The part 7 is what do you do for your infection? And in here, I talk about my favorite 2 herbs to go ahead and treat Lyme. These 2 herbs together work as successfully as prescription antibiotics. They will work 85 to 90% of the time. So toba bark extract and cat's claw, okay? Now, toba bark extract, everyone, is actually a product called Banderol, made by Nutramedics, and cat's claw is a product called Cemento, okay? All right, so you can follow how I recommend to do that here, all right? And then there is a section down here about treat your co-infections. And again, there are 2 articles, one called Kills Bartonella, one called Kills Babesia, a brief guide. Both of these have herbal options. And I just want you to know that this morning I updated the Bartonella article. And what you're going to see here, I wrote it up here. I updated this article on 11/3/15. Actually, I guess that was yesterday, to include a rewritten section on herbal antibiotics that treat Bartonella. See the tier 3 section, okay? So there's 3 tiers, and the tier 3 right down here, I start talking about some herbs that you can use, okay? So that's in the Kills Bartonella section, all right? Let me see here. One other thing I just want to point out to everyone, for the longest time, I have not had a link to our store on the site because of some regulation issues. I've decided to make it easier for you. There is a link over to our supplement store here. And so if you're looking at where you can have the best chance of finding the herbs and supplements I recommend, the ones that we think have the greatest chance of helping you because they source for the most active ingredients and because they don't include artificial fillers that will help you. This is the supplement site that my patients get their supplements from. It's the one we run out of our clinic here. And we make these supplements available to you as well too, okay? If you're looking at how you find them, you can even look through by medical problem. So for instance, we have a whole section on infection, and in here you can find the Banderol as well as the Cemento that I was just mentioning, okay? So anyhow, take a look here. These are the herbs. If you want to make sure you're using herbs that have the greatest chance of helping you while not having toxins in them that could hurt you, look at what we've selected here at our supplement site, okay? And you can now find it linked to our Lyme disease information site too. All right, so let me go back here again. All right, Carol, thank you for that question. So there's a lot more you can do. Bioresonance, I don't think is going to give you much benefit. All right, and if I can help you in the future, if you want to do one of those one-to-one consults, I'd be very glad to help you look at things. All right, good luck to you. Let me see here. Hello, Jackie. See, great questions tonight. Your advice is helpful for lots of us. Thank you so much for your webinar and the treat Lyme, Dr. Marty. These are it's not even a question. Jackie, thank you so much. I appreciate that. I put a lot of time into this, and I'm glad that it's helping people into the webinars here, but also in the treat Lyme book, okay? So everyone, I know sometimes people get concerned because we charge for the treat Lyme book. We have a minimal subscription fee. It's worth it. I can't be with you every night doing webinars, and the kind of advice that I'm giving you here is the same practical advice that I give in the treat Lyme book. It is a very useful resource. There's things there in there that you can do to round out your treatment. There's ideas you can bring to your doctors. There's even things you can do to just design a treatment by yourself. So as Jackie has just stated here, and as many of you know from the way I describe things here, there's things you can do, okay? There's things you can advise your physicians to try. Yes, you can advise your physician. Why not? It's your illness. You should be able to give some direction on it. And so there's resources here that you can use within the treat Lyme book. So yep, it is a subscription. I put a substantial amount of time into that, maintaining it, updating it, and I've started rewriting articles again after a pause this summer. So for instance, the two of the newest articles, I updated the one on Bartonella I just told you about, and there's another one that I wrote and recorded about my feelings on hyperbaric oxygen and hydrogen peroxide, okay, as treatment options too. So those are two new things now, okay? So I'm back putting out new articles again as well too. And I think down the road, I think there may be the two next ones maybe on low-dose immunotherapy. I need to research it a little bit more. I did give you my opinion tonight, but I want to have a little bit more meat behind it before I start writing that article as well too. So thank you, Jackie. I appreciate that the comments. All right, let's see here. So the next question is from Kate. And unfortunately, it's showing up in a way that I cannot repost it for everyone to see. So what I'm going to do, I'm going to do a quick copy of it, and I'm going to post it as though I wrote it. And then I'm going to show it to everyone. So let's see here. Hello. Okay, so everyone, this is not my question. This is from Kate, okay? See, I have been on antibiotics and body support meds prescribed by my Lyme doctor morning and night for Bartonella and Babesia since January 2014. I feel like I'm worse. Should I keep going? I wouldn't stop, but I would rethink some things just by that, okay? So first of all, if you really want to know what I think, this is a situation where I really, Kate, I'd be glad to help you look at all of this, okay? But this is a kind of question that probably would be better handled if you were to do one of those one-to-one consults with me, okay? There's a few things I think about, though, when somebody's being treated, they're not getting better and they're getting worse. Number one, when we use antibiotics, even if we do good things to prevent getting too many yeast in your intestines, and those preventive things would be to be on probiotics, maybe be on nystatin, but it is very possible that you could develop too many yeast in your intestines. And that can cause a lot of your symptoms of Lyme to look worse. Remember earlier tonight, I described that the reason you feel badly in Lyme is that you can have an overproduction of a group of chemicals by the immune system called cytokines, okay? And cytokines in excess give you your Lyme disease symptoms. So it's a misnomer to say somebody has Lyme disease symptoms. What they really have are excess cytokine symptoms, all right? If you get too many yeast in your intestines, they trigger excess cytokines. They also release toxins. And so if I get the story that I'm treating somebody, or if in my patients, as I'm treating them, they start getting worse, especially this far into treatment, or even 6 months into treatment, if they've been doing better, but they start to get worse, I start wondering, are there too many yeast in the intestines, okay? There's an article, I'll show you in a minute, that you can look at, that you can see, you can use to figure out, do you have too many yeast in your intestines? I'll show you that in a minute, all right? But the other thing I worry about when this happens to somebody is I'm wondering, have the right germs been treated? So do you have Babesia, for instance, that's not being treated? Oh, you've been treated for both. Well, I would still wonder, have they been adequately treated? And I would look to see the symptoms. I would look to see, do you have symptoms of Bartonella? Do you have symptoms of Babesia? If not, I might change your treatment up. And if you haven't been treated for those for a while, it's possible you can get into Babesia and Bartonella relapses, actually, okay? So let's say your doctor handled them well to begin with, but now you suddenly start having less symptoms of Bartonella or Babesia. Well, they need to be treated again, all right? So that could be another reason you're not doing well. Third reason you may not be doing well is that it is possible you are not able to handle toxins of the Lyme germ. And as the more that you kill them, those toxins are just recirculating in your body and you're not able to get them out. And so there's treatments you can do for that as well too, okay? So those are 3 areas I would look at. Let me show you an article or 2 that might give you some resources, but ultimately if you really want to help tease this out, look at one of those one-to-one consults that I described earlier tonight. This is a perfect situation where I can help you look at this, okay? All right, so let me do a screen share here again. All right, so we're back here in the Treat Lyme book. And I'm going to just do I'm going to go over here. Okay, so there's an article here called or a chapter called Can't Get Better, Do This. All right. So this was written with you in mind. And I'm going to point you to a few things in here. Okay, so I say could be a detox problem and it could be a yeast problem. Okay. Now I know I mentioned a bunch of other things here, but I think in your situation, what you just described to me, I would think of detox, primarily Lyme and mold biotoxin issues. And then I would think about yeast. So let's look here at yeast. Actually, okay. So on the toxin issue, you want to look at this article called Lyme and Mold Toxins, a Lyme Bite. This is the one that will help you figure out whether you've got a Lyme and mold toxin issue, okay? And down here, I talk about what to do about it, how to figure it out, all right? So that's one option for you. There's even a video with this one too. And the other one I would look at in terms of yeast to figure out if you have too many yeast, look at the yeast chapter. And in the yeast chapter, there is an article called A Silent Problem, Do You Have Yeast? Okay. Click on this. I talk about how to diagnose yeast in here so you can figure out whether you have yeast. You don't need a doctor to help figure that out. You can figure that out, okay? And then if you do have too many yeast, take a look over here at our article on how you kill it. And there's herbal recommendations and prescription recommendations as well too, all right? All right, so let me go back here. All right. So Kate, I hope that gives you some information. And I would consider doing one of the one-to-one consults. Okay. All right. Take care of yourself. And thank you for that question. Hello, Shirley. Let's see. Hi, Dr. Ross. Do you treat children? Yes, I do. I have quite a number of children in my practice. And so to answer that question, yes. All right. Thank you for that question. Hello, Randy. It's good to see you back here again, actually. I was in remission. That's probably why I haven't seen you in a while. Feeling much better for 8 to 9 months. I relapsed 6 weeks ago with all the familiar Lyme symptoms. 3 weeks before the relapse, I had 3 epidural steroid shots for pain from a nerve impingement. Do you think the steroid shots weakened my immune system that all the symptoms returned? So I got a couple comments here, actually, Randy. So one is, yeah, it's possible. It's possible. So everyone, steroids are not a good idea in Lyme. They can suppress the immune system, which can allow the germ that's being held in remission by the immune system to get active, okay? So Randy, that is a possibility. Now, of all the ways of using steroids, an epidural steroid injection is an injection around the nerves as they come out of the spine. So, and usually it's in a pretty contained space. So the risk of getting a lot of absorption throughout your body is small, but it can still happen, okay? So maybe that is what happened. The other thing that can happen, though, is steroids also can make it easier for yeast to overgrow in your intestines, okay? And the reason I say that is, in my experience, 80 to 90% of the time that somebody looks like they have a relapse, what I will look for first, the first thing I'm going to look for before deciding it is a relapse, I want to consider, is there too many yeast that have started growing? Are there too many yeast that have started growing in the intestines? And Randy, as you know from what I just described earlier, they can look the same. Too many yeast in the intestines trigger cytokines, just like Lyme triggers cytokines, and too many yeast trigger more toxins to be made, which can flare up cytokines as well too, okay? So I would also consider, do you have too many yeast? And so things to look at this point in your treatment, if you might have too many yeast, you would consider, do you have increased sugar cravings? Do you have a lot more gassiness and bloating? Other signs that can indicate too many yeast are having acne and pimples showing up after you haven't had those for years, maybe not since you were a teen. Difficulty swallowing sometimes, because if you get too many yeast in your food pipe, it can make it difficult to swallow, for instance, okay? So these are things that you would think of that might indicate too many yeast. So that's something I'm always looking for. When I got somebody that quote unquote relapses, I'm first going to start looking for yeast. I have found it time and time again. Correct the yeast, everything goes back to a good place again. Okay? All right. Good luck to you, Randy. Oh, Randy, one other thing I want you to know is, even if this is a Lyme relapse, generally, I find that people will come out of a relapse pretty quickly, usually within about 4 months. That's in general, okay? So it's usually not going all the way back into that big treatment hole again. All right? All right. Good luck to you. Let's see. One. All right, let's see here. Hello, Natalie. I am giving Epsom salt baths to my son. I am putting about 1 cup in the bath. Can I increase the dose for Epsom salt to 2 cups for a 9-year-old boy? Thank you. You can increase it, Natalie. Basically what Epsom salts are is they're rich in magnesium. All right, so you're getting magnesium absorption into his skin, and therefore into his muscles. I don't think that 2 cups is going to give him too much, but watch, okay? If it's too much, he's going to get really lethargic, more than you might see from just a hot bath, okay? But I think you'd be okay going ahead and doing that. It can help with muscle achiness quite a bit, actually. All right. Thank you for that question. Hello, Karen. Let's see. I'm back on by accident Plaquenil for 3 months. I have symptoms of Lyme and BART. Not responding as well to this protocol as the spring. Just tested positive for alpha gal. New infection. Changed drugs. Thanks. So Karen, I guess I would need to know a lot more about specifically what's going on, but I would reiterate what I said to Randy just a few minutes ago. If you're not getting better, you've got to go back and relook at the presumption that this was a relapse. It might be that you have too many yeasts going on, masquerading as a Lyme infection again. Okay, that's just something I would consider. And especially if you've been doing this and you're not responding, it could be because you got too many yeast in your intestines and the antibiotics are knocking down good bacteria, which is causing even more yeast to grow. So you're getting worse and worse. All right. But those are just some initial thoughts. I'd be glad to help you look at this more if you want to do one of the one-to-one consults, but those are just some ideas for you to consider. Okay. All right. Thank you for the question. Okay, let's see here. Hello, Lana. See, hi, my doctor suggests I should use MMS. She says she had good results with this despite of what some people on the internet are saying. What do you think about this therapy? I'm not opposed to it. I'm not for it. I see mixed results with it. Supposedly what it's going to do is it's going to raise oxygen levels in the blood. That's what it's supposed to do. As to whether it really does that, I don't know. And again, I see mixed results. It's not one of those things that I recommend to people. The reason I say I see mixed results is people come in telling me that they're doing it and what kind of reactions they're getting out of it. Okay? All right. Good luck. All right, so I'm being asked a question that I don't know the response to, but I'll just say it. So, hi, Ann. Let's see. My question disappeared off the screen. I'm not sure what happened with that, but so when you send a question to me, it will be off the screen usually. Okay, usually. At least I think that's how it works. Maybe I'm wrong, but anyhow, in terms of peptide 1018. And biofilms, I haven't seen information about it. I haven't seen any research that says anything about it, and it's not something I'm actually familiar with. So I'm not going to be a good source on that one. Okay? All right. All right, let's see. Hi, Charlene. Let's see. Hi, Dr. Ross. My dentist told me about another patient of his who has LD2. He is distraught and is going to have malaria therapy. We live outside the Boston area. What are your thoughts? Thanks for sharing your time with the Lyme disease community. So I don't know what you mean by malaria therapy. I'm wondering if what you mean is the drugs we use to treat babesia are malaria medicines. They actually are. Or are you talking about another kind of treatment? There's not enough here for me to be able to figure out how to respond to that. Okay? All right. Let's see here. Hello, Jean. Let's see. Hello, Dr. Ross. I've been treating Lyme, Bartonella babesia since 2011. I have started having severe coughing spells that end in gagging. This is totally involuntarily similar to retching when vomiting. It has become scary. Does this mean it is my vagus? Should I go to an ENT? I'd start with some basic work first. I mean, before you go to the ENT. So coughing could be a throat issue. It could also be a lung problem. And where I would start with this kind of situation is I'd wind up getting an x-ray of your lungs first. Make sure we don't have some kind of a pneumonia sitting there, maybe an inflamed lymph node that's tickling your triggering the coughing going on. And I'd get somebody to listen to your lungs first. You also, in terms of the coughing, I would want to know, are you getting postnasal drip? Do you have an infection in your sinuses dripping backwards, irritating things here, sending you into spasm, in which case the sinuses need to be taken care of. So those are some things that I would go ahead and consider. But I'd get your sinuses looked at first by your primary care doctor, probably. Also have somebody listen to your lungs and possibly get chest x-ray to make sure you don't have some of the basic things going on first before you go and have an ENT evaluation. All right? All right. Good luck to you, Gene. Hello, Kelly. Let's see. Hi, Doc. After my daughter was born, my hormones went crazy, to be expected, and I developed extremely painful tiny bumps in my fatty tissues with severe nerve pain in them and around them. Biopsy was normal. They checked for lipomas and cancers. Heard of this? Could it be BART? The answer is yeah, it could be BART. BART is known for giving, and it's not that common, but you'll see these little like pebbly kind of bumps that develop on the skin, okay? I sometimes will see nerve pain associated with that. Now, it doesn't mean Bartonella is causing it, but you can see that in BART. And these are one of the situations where I would think about treating for BART, okay? Just to see if it gives you some relief. I would feel stronger about treating for BART if you happen to have some of the Bartonella symptoms as well too, okay? So anyhow, those are the things that that's what I would think about doing with that. All right, thanks for that question, Kelly. All right, let's see here. Hello, Javier. Let's see. Can transfer factors for Lyme and co-infection treat the infections? And if so, for how long should you take them? So transfer factors, everyone, again, as I described earlier tonight, transfer factors are proteins that are made by the immune system, by the detective side of the immune system, where they can see germs and they can figure out what the germ is, but they got to give the information to the army to turn the army on to fight the battle, okay? And those are called transfer factors. And again, there's a transfer factor mix called Transfer Factor Lyme Plus. It's made by a company called Research Nutritionals. You would take it as 1 pill twice a day, and it has transfer factors in it against the Lyme germ. I get limited success, though, if it is the only thing being used to treat Lyme if somebody's got an active infection. I may use it to augment my treatments, and I definitely am going to use it in considering what to do to have somebody prevent relapse. So it might be something I have a person take at the end of the treatment. How long can you take them? I think you can take them indefinitely. I don't have a problem with people doing it on an ongoing and regular basis, okay? All right. Thank you for that question. Hello, Jeananne. Let's see. Besides cholestyramine, what can you take for mold detox? Is there anything natural you recommend? Yes, I do. So I like you. So everyone, with mold detox, also known as biotoxin illness, and also Lyme detox for some people falls into this too. So there's 25% of people that have what I call biotoxin illness, which means they cannot get mold and or Lyme toxins out of them. What happens in 75% of people is the immune system sees those toxins, tags them, they go to the liver tagged, the liver takes them from a fat-based toxin, turns them into a water-based toxin, they get moved out into the intestines and you poop them out, okay? But if you happen to be one of the 25%, that tagging doesn't take place. Those toxins go to the liver, fat-based. They get pumped out as a fat-based toxin. They go into the intestines and they get reabsorbed. So you can't get rid of them. So what you want to do is bind them up in the intestines so you poop them out. Cholestyramine is a prescription that is used to treat high cholesterol that can do that. Okay, so that's one option. But the other option, and this is the strongest thing we have, another thing you can use is something called fractionated pectin powder, also known as a modified citrus pectin. I think it's probably about 60, 70% as potent, capable as the cholestyramine. It works fairly well. And you would want to do 1 scoop twice a day to 3 times a day. It's pectin. Pectin is a soluble fiber that comes from apples and even citrus, okay? And it can do a fairly good job, not quite as potent as the cholestyramine. The good thing about it, though, cholestyramine, there's a lot of timing issues with cholestyramine because cholestyramine binds a lot of things, okay? So with cholestyramine, you got to stop your medicines and your supplements at least half an hour before you take it, and you can't resume them until 2 hours later. That's not the case with the fractionated pectin powder. Fractionated pectin powder, you can actually take it anytime with anything, all right? So let me show you where you can find that real quick because it's not always the easiest thing to find. Let me go ahead and do a screen share for that. All right, so I'm going to go back to the supplement store, Marty Ross MD, Terrabrook ND supplements. And what you could do is just do a search for it. We'll say fractionated pectin powder. And there it is. All right. So this is a product made by Thorne. It's a very good quality product. Okay. And you can see it here. So take a look at that. Okay. And then let me go back. All right, thanks for that question. All right, everyone, that's it for me for tonight. Another hour and a half with you. I've had a good time here. I'm going to take next Wednesday off, okay? I'll do these 3 weeks in a row, and then I usually need a break, and you get my Wednesday nights back every now and then. I've enjoyed being with you here tonight. I intend to have the video recording handled tonight and ready for publication tomorrow. You should get an email from me in the morning. Some of that depends on how YouTube cooperates with me because this is recorded right into YouTube, and sometimes I've had some technical problems with them, okay? But my intention is to do a quick edit and get that thing up to you tomorrow morning. Tomorrow morning, you are also going to get an email from me, and in that, I intend to have it set up so that you can sign up for the next series of webinars. Again, those will begin in about 2 weeks. They won't be next week, okay? And here in a second, I'm just trying to get it set up so I can do this with you. So I'm going to take everyone, I'm going to redirect you at the end of the webinar here back to our website, okay? And through the website, you can go ahead and subscribe to the Treat Lyme book. If you haven't subscribed, just click on any article you want to read. You're going to be presented a screen that says subscribe. I hope you'll do that. I hope you support the work that we're doing here. Also, if you happen to know our work is helping you, spread the word. Either spread the word about the Treat Lyme book or spread the word about the webinars. I want to help as many people as possible. That's my mission. I want to help as many people as possible with this illness, which I can do here in the office, but I know I can do it this way too and reach many more people as well too, okay? So anyhow, that's it for tonight. I look forward to visiting with you all in a couple weeks. Good night.